It's very difficult. Like we said, each symptom, and we said which system is it associated, but it is really not easy to identify it like that always. So we have something called as toxidromes. So toxidromes are a group of symptoms which are usually associated with certain type of poisonings because they act in certain ways in the autonomic nervous system and in the brain. So the toxidromes are characteristically there for sympathomimetic drugs, anticholinergics, cholinergics, sedative hypnotics and opioids. So we are going to talk right now about the individual toxidromes. So now is the sympathomimetic toxidrome. So we would be showing what will be the associated symptoms of these toxidrome with respect to the individual systems. So sympathomimetics, there will be a high blood pressure. They will present with sinus tachycardia. The respiratory rate might be normal to high. Temperature might be normal to high. And eyes, there will pupillary dilatation. And there will be skin diaphoresis. There will be normal secretions, but they will be agitated and they will have psychosis and delirium. We had already said it there initially, in the neurological examinations also. Sympathomimetics would be associated with agitation, psychosis and delirium. So what are the drugs that cause increased sympathomimetic activity? The common drugs that we normally see associated with these are amphetamines, cocaine, pseudoephedrine, caffeine and theophylline. So anticholinergic toxidrome, this has a combination of, one is the loss of cholinergic innervation and another is increased sympathomimetic activity. So they will also be having the symptoms, as we said earlier, for the increased sympathomimetic activity. So again here also there will be increased blood pressure, there will be a tachycardia, respiratory rate and temperature might be normal to high. Here also the eyes you will have pupillary dilatation. But how do you differentiate it from the sympathomimetic acting poisons is the skin and secretions. They are usually dry. Here also they have agitation, delirium and mumbling speech. So what are the drugs that cause anticholinergic toxidrome? One is antihistamines, tricyclic antidepressants, atropine and phenothiazine. In children we might see commonly antihistamine toxicity due to accidental overingestion. So anticholinergic toxidrome, there is a mnemonic for this for us to remember it much more easily. It's a very old and very common mnemonic. It's mad as a hatter, where there's altered mental status, blind as a bat, where there's a dilatation of the pupil, red as a beet, they have a very flushed skin, hot as a hare, they have dry skin and anhidrosis, and dry as a bone, there's a dry mucous membrane. So next we are going to the cholinergic toxidrome. So in cholinergic, the most common that we always see is organophosphorus. It's usually commonly, this poisoning is usually associated with pesticides. So what are the clinical manifestations in this? Are initially the blood pressure will be slow, the cardiac rhythm will be low, there will be sinus bradycardia, the respiratory rate will be low, the temperature will be low, the eyes will be myotic. So there will be constricted pupils, there will be increased secretions. So the skin there will be lots of sweating, there will be diaphoresis and there will be increase in oral secretions, there will be diarrhea, and they will also have neurological manifestations like coma, fasciculation and confusion. So there is a cholinergic mnemonic also for us to remember it much well. There we have two in that. You can take which mnemonic is easier for you to remember the cholinergic symptoms. One is sludge, where there is salivation, S, L for increased lacrimation, U for increased urination, D for defecation and diarrhea, G for gastrointestinal dysmotility and E for emesis. Or there is another mnemonic called as dumbbells, where there is D for diarrhea, U for urination, M for meiosis and muscle weakness, B for bronchoria, B for bradycardia, E for emesis, L for lacrimation, S for salivation. So the next toxidrome we are going to is sedative hypnotic. So sedative hypnotics predominantly mostly cause respiratory depression. They will have somnolence. There might be loss of airway protection also. So initially in these type of toxicities, the ABC is very important. That's why we normally say when there's a poisoning also, you have to initially be more towards the emergency management, that is the airway, breathing and circulation, and then later we have to start trying to identify which toxin has caused this. So there can be respiratory depression, and drugs usually causing this are barbiturates, benzodiazepines and ethanol. Toxidromes of opioids, I already said this previous, they is similar to sedative hypnotics. Here there is meiosis associated with that. There can be here respiratory depression also. The opioids associated with this are usually morphine, methadone, heroin and oxycodone. The next toxidrome we are going to talk about is serotonin syndrome. So it has serotonin syndrome symptoms mainly are like increased sympathetic activity. There's increased blood pressure, there's increase in heart rates, tachycardia is there. The respiratory rates may be normal to high. They can have increase in temperature, hypothermia, the eyes would, pupils will be dilated, mydriatic. They can have increased secretions, copious secretions, they can be profusely diaphoretic. And neurologically, they have a characteristic manifestation of clonus, hyperexcitability, especially in the lower extremities more than the upper extremity. So, serotonin syndrome is associated with increased serotonin in the blood, which is mainly because of certain drugs that cause it, like SSRI, serotonin receptor inhibitors, lithium, MAO inhibitors, linezolide. So, this is an antibiotic which causes serotonin syndrome, tramadol and meperidine. So, salicylate toxidrome, next that's what we are going to talk about. So, the symptoms of salicylate toxidrome here also they can have increase in, they can be tachycardia, they can have increased respiratory rate, they have increase in temperature, and pupils are normal. The skin, there's diaphoresis, there's increase in nausea, vomiting, there can be agitation, confusion and coma. So, like it's presenting just like the sympathetic syndrome, the cholinergic toxidrome. So, how do you identify this? There's something different in salicylate toxidrome is the hyperapnea. They will have respiratory increase in fast breathing, as well as they can present later with metabolic acidosis. And tinnitus is another characteristic feature of salicylate toxidrome. So, common agents causing seizures, this is the next thing we are going to see. So, this has also been put as a mnemonic, like it's called as CAP. C is camphor, carbamazepine, carbon monoxide, cocaine and cyanide. A is aminophylline, amphetamine, anticholinergics and antidepressants. And P is for lead, pesticides like organophosphates, phenol, phenothiazines and provoxifen. S for salicylates and strychin. So, now we are going to the lab. We have seen the full physical examination, a detailed examination and how to assess for poisoning with the basis of physical examination. Now, we are going to go to the lab clues and diagnosing of poisoning. So, the first thing we are going to see is anion gap, metabolic acidosis. So, what are the drugs that can cause increased metabolic acidosis with increased anion gap? So, this is also put as a mnemonic. It's called as MUD